You know, it's interesting. I'm sure you've investigated this model, but we've got this rapid changing of centers of care occurring right now in the economy, in the world. And so we are moving away from the big monolithic brick building in the middle of town called a hospital. And now we're starting to see private equity money get involved in these focus factories, whether they're orthopedic ambulatory surgical centers or cath labs being sort of all rolled up by private equity firms. And also, we all are aware of this started in the imaging world, certainly decades ago, and now is going to also be accelerated. So how does the Elucid platform potentially play to that expanding model?
Absolutely. So we continue to see the rapid growth of imaging centers and use of imaging. And so for patients where you might previously need to go to a cath lab to have an invasive diagnostic in order to make this determination of how to treat the patient, should we stent, should we not, there's now the opportunity for this to become increasingly controlled by the primary cardiologist, who may order such an image, or even a primary care physician who may order such an image, receive the result, be able to interpret it to determine, does this patient truly need to go to the cath lab for revascularization, or should they be put on statins or even more intensive therapeutics? So it's putting more control in the hands of the physician to make that determination and avoid unnecessary invasive diagnostics, but also be able to improve care to avoid those trips to the hospital that would result from a cardiac event.
And to pick up on the architectural capabilities that Elucid offers, there isn't a one-size-fits-all. Many facilities might prefer to offload the analyses to a supplier. However, there's some that, whether it be that they can't or they don't want to, or that they just have the in-house capability, they viewed it as strategically valuable to build up that capability. If the analysis software that is developed has in mind sort of only one way for it to be used, then you're not going to be able to hit those opportunities that exist in different types of organizations. And so whether it be really small, innovative organizations that want to do things differently, or larger, far more established institutions such as the VA, they have differing needs with regard to how they want to receive the benefit of this. From the very beginning, we have architected this in a way where it can be utilized by our own trained staff to provide analytical results, but it can also be put into the hands of the individual providers themselves, and there are different options there as well. That doesn't happen for free. The software architecture and the decisions that are made in terms of the product design need to be taken from a very early step in order to achieve those degrees of freedom.